Hi, everyone. I'm Dr. Manju Sengar. I'm a professor of medical oncology at Tata Memorial Center, and I'm part of India Leadership Journey Cohort 2022. I'm going to talk to you about my project, Understanding the Reasons for Delays and Treatment Abandonment Among Women with Cancer. So, why this project? 17 years back, when I joined this institute, after completing my training as a newly minted faculty, I was armed with the knowledge and the passion to change the world, and I landed up at the right place which treats riches and poor exactly in the same manner. So I thought that I have the right place, the right knowledge to do what I want. However, the reality was completely different. On one fine day, a 23-year-old newly married girl came with a blood cancer, which was highly curable. We went out of our way to arrange everything for her. However, the next day, husband abandoned the treatment and took her away. And that's when I realized that just the knowledge and the right place is not enough. We looked at our data and we realized that there is a huge gap in sex ratio at diagnosis, which only worsens as the treatment progresses. Reasons like lack of money, no social support, staying in the city of Mumbai for months altogether, leading to loss of livelihood, cancer stigma. These were some of the reasons, and therefore something was needed to be done to complete the treatment for all these patients with dignity. And that's when WomenLift came along. And I wanted to understand this problem a little more from those who are having these issues. So that means people who did not come back for further evaluation and treatment after the diagnosis was made in their first one or two visits. We needed the right tools to listen to these people, and therefore I collaborated with the social scientists, people who have expertise in the qualitative research method, and conducted open-ended interviews. A lot of people were involved, including the caregivers and patients, social workers, translators, coordinators, to give this project a shape and a meaningful direction. And of course, the need of this project was to be communicated to those who are going to make these changes, like hospital administrators, social workers, clinicians, policymakers, and those who fund the treatment for these patients. When we looked at 149 patients, we realized that almost 27 had died after leaving the treatment. There were few who were not contactable, and almost 58 patients refused to speak to us. Of the 39 who spoke, there were few common themes which emerged. Women did not participate at all in interviews or spoke very briefly. None of the patient wanted to abandon the treatment. It was only a delay or pause and what we call as patchwork oncology. Some of them opted for unproven therapies, and people did try to fit the treatment in their lives. So what it indicates is that there is something more beyond just arranging money, arranging for social support. And this project covered practically all the elements of effective leadership. It was authentic, given that it was directly from my heart, inclusive of all the people who are involved, who are getting affected and who can make the change. Strategic, because I needed to find a direction to speak to those who left, and it was a challenge. And of course, the impact is very clearly evident that if you can make this change, you will be able to allow several of these patients to complete their treatment and have the potential cure which can come in. We realized that, from this particular project, that only delivering care at high quality and the tertiary care cancer centers is not the answer. We need to decentralize the care. And that's what gives me further impetus to work for National Cancer Grid, which is looking at decentralizing cancer care and delivery of uniform cancer care across the country. What I have learned as part of this leadership project is going to go a long way with me and help me in conducting several such initiatives and taking my ability to bring the change in the system in an effective manner. So thank you, WomenLift Health, for giving me this opportunity and taking me through this journey over last 1 year and allowing me to get armed with required tools to make the difference.